Now after that, we will talk about a couple of things here. Okay, what is this blue here? Okay, this blue right here is obviously, you know that this is going to be your venous systems, right? Because all this superior thyroid and inferior thyroid artery, what is they doing? They're bringing oxygenated blood to your thyroid gland, right? To the cells of your thyroid glands, because they work and they need to function. So they need, in order to function, okay, they require ATP. In order to have ATP, you need oxygen, right? So this thyroid arteries, superior and inferior thyroid artery, they're bringing oxygenated blood to my thyroid gland. But what is going to happen to the deoxygenated blood? Okay, that deoxygenated blood is carried by so-called your venous systems, right? So there is one branch that's coming from this guy right here, okay, and this is, you can think about this is like this vein right here, okay. You can think about this as internal jugular vein. What is it called? Okay, it is called internal. Okay, there is external jugular vein too, but I didn't draw that. I just draw internal jugular vein. Okay, and even this one also you can think about internal jugular vein. Internal jugular veins. Okay, let's draw it in black. Internal jugular vein gives a branch here. Okay, let's draw it in blue. You'll see. Okay, let's give it a branch here. Okay, and it goes to like superior down here. Okay, this branch. Okay, which is bringing the deoxygenated blood. Okay, deoxygenated blood. Okay. This is so called as your superior, okay, thyroid vein. Okay, that's what it is. So superior, we can say superior thyroid vein. Has to be, okay, that's what it is. And then, you know, the funny part is that, you know, this internal jugular that gives also in the middle of the branch also goes and supplies here. Okay, and this is called middle vein, middle thyroid vein. Okay, that's what it is, middle thyroid vein. Okay, that's what it is. Because superior vein, okay, goes and work on the superior part, and then it brings the deoxygenated blood. But also internal jugular vein also give one more branch, okay, and then from the middle of the internal jugular vein, and that supplies to that goes to your so-called middle part of your thyroid gland, okay, and they simply call this a middle thyroid vein, okay. Now there's one more. That means if there's superior, there's a middle, there has to be inferior too, right? And there's also inferior vein too, okay. But the inferior vein that is actually bringing deoxygenated blood, okay, what is going to happen is that, look, what is going to happen is that it is not coming from the internal jugular vein, because what is going to happen is that this superior thyroid veins and this middle thyroid veins, they drain into so-called internal jugular vein, okay, that's what is happening, okay. It is bringing deoxygenated blood and draining into internal jugular vein. Same thing here, okay. Bringing deoxygenated blood and draining into my internal jugular vein. So this is superior, this is so-called inferior, okay. Now, there's a branch, okay. Basically, other one is so-called as this guy right here, okay. There's also one more vein right here, okay, which is bringing the deoxygen from the inferior side, okay. Let's make this, this one, I actually drew this one right here, this one. And even here, okay, this one. These are called inferior, okay, inferior vein, thyroid vein, okay. They are draining the deoxygenated blood into brachiocephalic trunk, and you have to remember this, okay. Again, the superior and middle, those thyroid veins, okay, they are draining into the internal jugular vein, the deoxygenated blood. But the exceptional part is the inferior thyroid veins. They are bringing deoxygenated blood and draining into so-called brachiocephalic trunk, okay. That is one of the exceptions that you should remember that, okay. Now, once we talked about this, okay, now you know the supplies, the blood supplies and the venous systems, okay, that to your thyroid glands, okay. Now once we have that, we have to talk about like the thyroid gland, okay. What is the structures of the thyroid gland, okay? You have to look at this. As we said that thyroid gland is a butterfly set of structures. So come here back here, okay? And this blue right here in the cells, okay? These blue cells are known as called principal cells, or more popularly that is used known as called your follicular cells, okay? And the reason why they call these follicular cells is because, you know, there is a central cavity there, and those central cavity is closed by, okay, the epithelium cells around, okay. So that's why they call the follicular cells, okay? Because there's a cavity there, and those cavities are closed by the cells nearby, okay? That's what it is. So if I quickly take, let's say, one piece draw, and let's say I draw here, okay? Meaning that there's, let's say this is a cavity right here, okay? And there's a cells that's surrounding here, okay? Like this, okay? All of them area right here. Okay, look. And this is called central cavity or lumen, or for our case we call them as a follicular cavity. Okay, you can call this as a follicular cavity, right? And these cells are lining the so-called as this central cavity, and these cells are more, okay, now let's do this. If they are inactive, okay, they appear to be, okay, low, okay, cuboidal, okay, low cuboidal to like a squamous, okay? That's what it is. But whenever they're active, okay, whenever they're working, okay, functionally working, these cells can be appeared to from the, cuboidal to like, okay, like cuboidal to so-called as your low columnar, okay, on their shape, low columnar epithelium, okay, whenever they're active, okay? Now, one more thing you have to understand here is also this outside of the cells, okay, these cells, these are follicular cells we call them, okay, and they're spheric, okay, they look spheric in natures, okay, and these cells, outside of this cell, there are other cells also right here, okay, and these cells, outside of the follicular cells are called parafollicular cells, okay, and parafollicular cells are very, very important because these guys are known as for synthesizing one hormone, very important hormone, and that is called calcitonin, okay, calcitonin. And calcitonin, what it does, it removes this extra calcium from our body, okay, that's what it does, okay, and we'll talk about it in physiology in more detail. These follicular cells are the one that synthesize your thyroid hormones, right? That's the reason why these follicular cells are so-called as a functional unit of your thyroid gland, okay? These follicular cells are so-called as your functional unit of your, okay, let's just write down, your functional unit of your thyroid gland, okay? TG, thyroid gland. Now, this is just the structures of your thyroid gland, okay? Because these thyroid glands are like, composed of these follicular cells, okay, or principal cells, okay? And one more thing that I have to mention here is that in the thyroid gland, okay, if you look at the posterior of the thyroid gland, you get to see 4 different glands also there, okay? Like if you come back here, okay, you can view this as a anterior view, and then you can see this blue as your parafollicular cells, okay? These guys, you can look at this structure in a posterior view, okay? What do we call the posterior view, okay? Now, if you look at these posterior view structures, okay, you see the pink structure right here, okay? Look, like here, see the pink? These are your parathyroid gland, okay? What are they called? They call you parathyroid gland. And it's very, very important that you understand the role of parathyroid gland. Okay, in physiology, we'll go more detail about this. But just for now, you know this. In the thyroid gland, that's where you find your parathyroid gland too, okay? So, whenever you remove a thyroid gland, what is going to happen to parathyroid gland? Just think about it, right? Now, you think about that. These parathyroid glands what is the role of this parathyroid gland? The role of the parathyroid gland is synthesizing this hormone called, we have talked about this in kidney too, parathyroid hormone, okay? And what this parathyroid hormone does is very, very important hormone. It helps with the reabsorption of a calcium, and it also traces out your phosphate. That's what it does, right? Remember, thyroid gland is a very, very important, it's a gland, right? It's an important organ because remember, it is synthesizing 3 different like hormones. One is calcitonin, one is parathyroid hormones, and other one is your thyroid hormones, okay? That is why, thyroid hormone considered to be one of the most important gland in our body, okay? Because it has very, very important role, okay? Especially those thyroid hormones, okay? The thyroid hormones, as I said before, it works almost in all the cells, okay? It's very, very important, okay, to maintain your thyroid level, okay? Now, after this basic, okay, anatomy, and then a little bit of like so-called histology, okay, next what we're going to do is that we're going to go and we're going to talk about the physiology of this thyroid gland, okay? Physiology of how this follicular cells of thyroid glands produces your thyroid hormones, okay? And then we'll also talk about the role of your parathyroid hormones and also calcitonin, okay, in our coming lectures, all right? Okay, guys, this is all I have for you guys. Thank you for watching, and please don't forget to hit the subscribe for me. Thank you.